Hi, my name is Eric Weintraub. I am the marketing administrator for the USC Roski Eye Institute, and I'm joined here today by Dr. Kimberly Gokoffski, who is an assistant professor of clinical ophthalmology at the USC Roski Eye Institute, who specializes in neuro-ophthalmology. Our institute is following the current events, and we decided to put out this video to make anyone who wants to protest or also document the protest as a journalist be aware of the safety precautions that they can take to protect their eyes while they are out. And Dr. Gokoffski, the first question I want to ask you is, can you talk, we've seen some news stories about tear gas being used against protesters. Can you talk about how tear gas affects the eyes?
Yes, I'm happy to do so. So tear gas can be made of a number of different substances, and generally the source of this comes from peppers. And so the purpose is to irritate the eyes. And so the eyes actually are some of the most sensitive parts of your body. They have the most number of sensory neurons per area of any part of your body. So anything that irritates your eyes leads you to reflexively start to tear and close your eyes. And so that's the purpose of the tear gas, is to essentially, in some ways, incapacitate you by irritating your eyes. And so it'll cause your eyes to tear rapidly. You'll also start to notice that you leak mucus out of your nose. You'll feel very uncomfortable. And so it'll be hard for you to continue to resume normal activities for a while.
And can you also talk about, to that regard, how you can, there's been some, on social media, there's been some posts that I've seen that says, don't wear contact lenses if you're going to protest. Can you talk about if that's fact or fiction? Could you elaborate on that?
Yes, that is actually a very good question. Contact lenses, although really great for providing clear vision, pose an increased risk for patients who are protesting and may be exposed to tear gas, because contact lenses limit the flow of tears across the eyes. And so if you're wearing contact lenses while protesting and tear gas is released, the tear gas, once it gets into your eyes, will stay there longer. And so the reason why we tear in response to something like sand or tear gas getting into our eyes is it's a way for our body to flush it out. But the contact lens forms a barrier and keeps whatever irritant is in there longer. And what's really dangerous, though, is that if you don't take your contact lenses out, then the chemical is staying there longer than it was even meant to be. This can lead to scary consequences, such as clouding of your cornea, the clear part in the front of your eye that is essentially a specialized skin that needs to be lubricated and free of irritants to stay clear. And so when you get tear gas in your eye, it can cause a scratch on that part, which would then essentially block your vision. It's like driving without being able to turn on your windshield wipers when mud gets splashed on the windshield.
And if you were not able to take out the contact lens in a reasonable amount of time, could this cause any permanent damage?
Yes, absolutely. It's rare. Generally, these tear gases are meant to be used at a distance, and of course, in low concentrations, they are considered to be safe-ish and effective at riot control or in pepper spray. But at close range, they can burn that front part of your eye. And so if you, for some reason, were incarcerated long-term with the contact lenses and didn't remove it, it could lead to permanent damage. And this would be blindness that could only be repaired possibly by having surgery to replace that front part of your eye.
Wow. And then taking a step back for a moment, you were talking about droplets and how tear gas can cause you to tear up and have mucus come out. And I wanted to ask, with COVID-19 also being the pandemic is ongoing, how can you prepare to deal with COVID-19 and a protest at the same time, especially with these elements involved?
Yeah, so of course there's no fail-safe way to protect yourself, but if I were to recommend anything for protesters when they go out, it would be to avoid using contact lenses and instead wear glasses. Things that could be helpful include swim goggles, the ones that make a tight seal around the eyes, and so that would prevent tear gas from getting in. And scuba goggles that also include the nose would be even increasingly helpful. And then after that, it would be like a gas mask. Those are kind of things that you can wear over your, well, not as comfortable, but over your glasses to help you see, but also help keep you safe during this process.
That's very helpful. And I wanted to move on to another issue that we've been reading about in the news, which is the use of rubber bullets. What happens if a rubber bullet is hit in your eye or near your eye?
Yeah, so the problem is that rubber bullets carry a lot of force, especially if you're very close to where it was discharged. And so if a rubber bullet hits your eyeball itself, it essentially can cause permanent irreparable damage and permanent vision loss, in the sense that it'll damage the structures in the front and in the back of your eye. And so your eye is like a camera, where the front part of it, its purpose is to focus images, while the back part of it is like 35 millimeter film. And so when you damage the film, there's nothing that we can't replace the film. We're not at that level. And so these rubber bullets, if they hit the eye, pose a essentially almost guaranteed risk of damaging those posterior structures. And there's nothing that we have in our arsenal as physicians to fix this. And so these people will be permanently blinded by that. If they're hit around the eye, it depends. It also can lead to permanent blindness. And the reason for that is that the way that your eye is built, the bones that protect your eye, they come together at the back. And so forces that hit the front of your head over here, or the side of near the side of your eye, they can transmit those forces directly to your optic nerve, which is the cable that connects the eye to the brain. And that can lead to what we call traumatic optic neuropathy, which would also be a cause of permanent blindness.
Oh, wow. And one thing I want to ask to that point, they say that, if you were to have a finger cut off, there's a certain amount of time that it can be saved. Does it work with that? If there's an especially strong trauma to the eye, can it be saved if that person is rushed to the hospital quickly?
It's true that patients will experience trauma to their eyes from various causes. And our goal, especially if the eye is ruptured or broken open, split open, we consider this to be an emergency and recommend repair within 24 hours of the injury. That being said, these are the visual prognosis of the patient is really dependent on a case-to-case basis. And so if more interior structures are damaged, then there is a potential for restoration of vision, albeit probably not perfect. However, if the posterior structures are damaged, the prognosis is grave. We really just aren't there yet as a specialty.
That's great. This has been so helpful. I want to thank you so much for your time in telling us all this information. I think it's going to be really helpful. I hope it'll be really helpful to a lot of people.
If I can just add one more little thought.
Of course.
The other thing, that comes across our minds as healthcare providers during this time is to ask the administration of the police force to consider whether or not tear gas is a good option for riot control during the times of COVID, given that we know that the COVID virus exists in our mucal secretions. And so using using a substance that causes people to increase their mucus secretions potentially puts surrounding individuals at higher risk for contracting COVID.
Oh, wow. Oh, well, I certainly hope the police see this video, and we'll do everything we can to get this video to be broadcast as wide as possible, because I think everything that you said today is really important and people need to know about it. Thank you.
Thank you so much.